policy goal is to, I don't know, support implementation or support this, then that helps you decide, I'm not going to say everything that is there about these research findings, but we are going to focus on specific ones which support you to achieve your goal. Also focus on policy relevance, because if you're thinking of bringing about policy change, you know, or allocation of resources, you want to focus on data and information that supports that, you know, that directly speaks to the recommendations that you want to put forward. So again, just helping you zero in, or of course, zero in on the very important points you want to bring out of the information or the research reports or the research papers that you have. And of course, the final bullet here is translate into simple language. I think that is something that is always so important. Often people who work in technical areas, we have a way of, you know, just using our very technical languages, and yet sometimes you're speaking to journalists, you know, and they're not experts in that area. And sometimes the words you're using are too complex. So thinking more about how do I remove that jargon out of my technical work that I do. But also, if you must use jargon, you need to explain it so that you're not just using words, but you're also explaining them. And I'm saying that because I know that some of the research that Dr. Shogbamu has presented, I have found it very technical. And sometimes I've told her, can you just explain, you know, when you talk about all these micro chemicals in water and you have these big words, you probably must use them, but you have to explain what they mean. Don't assume that a lot of people know what they mean. Especially even for me as a researcher, I know my area, but I don't know her area, you know. So just being sure that if you must use a jargon, you have to explain it. But the other point here is really to break down, you know, break your research with scientific evidence to the common day language, you know, the language that people easily digest and understand. I like to talk about the fact that as researchers, we like to use percentages. Sometimes those percentages are really good, you know. When you say, you know, 90%, it lets people listen, you know, but sometimes some percentages you're using can get people lost, you know. So I've seen people use things like 58% of this group can't do this. You know, the policymaker, the media person has to start thinking about 58%, what is that, you know? When you have a finding like that, it's easier for you to think about what is 58%. It's almost 60%. And so it's easier for you to say 6 in 10 people, you know, in this population group are affected in this way, as opposed to you saying 58% of the population that we studied was affected this way, you know? And so translating also means that you're thinking about how do I break down the language, break down the scientific language in my data to speak about it in almost the common day language that people use. People will relate more with 6 in 10 people, you know, as opposed to 58%. And so how do you think about breaking that down to language that people easily understand your message? I'll move on to implications as well. And as I said earlier, implications are really, they help you to contextualize, to show the importance, you know, of your findings. And so these are broad statements that put data into context, and they really help the audience understand, you know, what the issue is. They will express either direction, you know, that your research may be pointing to. They may express new information that we didn't know before. They may express consequences, or they may show implied need, you know. And so largely, implications will answer the so what question, you know. Why do the research findings you're talking about, why do they matter? Why is it important, you know, for this, for the policymakers or for the media or for the public to pay attention to these results, you know? And why is it important for them to even address the problem that you are talking about? So implications become very, very important, you know, in contextualizing and drawing attention to your findings. And so this slide just gives an example, you know. So your results may show low condom use among adolescents. So what? You need to now come to what does that mean to help the policymaker or the media or the public see why that is important. So you might want to help explain why this matters, you know, through your implications. And we've given here some 2 examples of the implications. The first one is that, so there's low levels of condom use, and this means that adolescents are taking risks with their sexual behavior, which could lead to HIV, STIs, and unintended pregnancy and early childbearing. Another possible implication there is that all these can have irreversible impacts on the lives of adolescents, affecting their current and future health, well-being, and productivity. So when you start now, explaining to policymakers why the low levels of condom use are important, they might start seeing, oh, so it's really important for us to pay attention to this, because an intended pregnancy, for instance, almost always means that girls drop out of school, and that has a longer term effect on their economic independence and productivity. And so implications become so central, in making your message be impactful to the people that you are talking to. The next point to make on this slide is just, I think, examples, that the different angles to which your implications may take. You may want to link them to the magnitude or the scale. You may want to link them to trends, particularly if your evidence is showing that maybe that's a new trend coming in as far as this problem is concerned. And so you might want to show that in the last maybe even 50 years, we didn't have this problem, but over the last 5 years, this problem has really changed, and it's becoming important that we pay attention to it. You might want to do geographic comparisons, comparing different locations or regions in the country, or even comparing different countries, for instance. Sometimes policymakers need to be told that our country is doing so bad compared to the neighboring country in tackling this issue. Sometimes that makes them pay attention to your problem. You might want to link it to social and health outcomes. You might want to link it to existing goals and commitments. Sometimes our findings may mean that the bigger goals that policymakers are paying attention to will actually not be realized. And nowadays I see researchers really trying to link their research and implications to sustainable development goals, because a lot of governments are focused on sustainable development goals. They have various targets they want to realize over this period leading to 2030. And so can you link your findings to that? You could also link them to values and principles, as well as costs or savings. So if your findings could help governments save money somewhere, you could link them to that. So again, these are just examples, of some of the implications you might want to bring in to demonstrate the importance of the findings or the research results or the data that you are sharing. Finally, it's recommendations. Recommendations give specific interventions or actions needed and by whom. And so the important thing to think about here is who are you talking to? If you're talking to, say, parliamentarians or parliamentary committee, you really want to be sure that your recommendations are speaking to things they can do. So you don't want to be telling a committee of parliament whose role is to do oversight over public resources, to make policy, to make laws, and to represent their people. You don't want to be telling them about offering services, because their function is not to offer services. And so you want to give him recommendations that fit the audience that you are speaking to. And so for policymakers, you want to see, for this particular issue, what are the recommendations that Parliament can do? What can Parliament do? And so you frame your recommendations in that way. You also, of course, need to support them with evidence. Sometimes I've been in instances where you see someone present their findings and you see recommendations and you don't see the link between the research findings and the recommendations. And you also need to ensure that you are giving SMART recommendations. And I think we all know about the SMART acronym, which is you're trying to ensure that your recommendations are specific, they're measurable, they're action-oriented, they're realistic, and they're time-bound. I know that most of the times our recommendations, particularly those based on scientific evidence or research, are often, we struggle to actually get them to meet all these criteria. And so just bearing in mind that it's good to ensure you're trying to meet some of them, but sometimes you might not be able to meet all these 5 criteria in your recommendation. But important because you are hoping that people will act on your recommendation. Being more specific is important, ensuring that there's action in your recommendation is important, because then they see what they need to do as people who you want to act on it. So moving from research to policy, which is an important part of the evidence-informed decision-making process, you have your implications as that bridge, that helps you move from your findings to policy recommendations. And I think I've probably explained that in a lot more detail in the previous slides. In this final slides, as I wrap up these, I think one of the key thing to note that these are just examples that we are giving. And as I said, again, these examples are largely drawn from totally different subjects and areas of focus from what you're working in. And so you can really bear with us with this. What I'll do is leave this here for maybe a couple of seconds so we can all read the finding. And then in the next slide, we're going to see some of the implications that these researchers then came up with based on this finding. So I'll just time myself for 30 seconds when I know all of us would have looked at the slide.
Yes.
Okay, so 30 seconds are over. I think we've all read the main finding here. And so on the next slide, we will look at some of the implications that was then provided to demonstrate the importance of this finding, you know, and contextualize it and just make policymakers see why it's important for them to pay attention to this finding. So the first implication here that was drawn again based on that finding that we've just looked at is that when a range of family planning methods are easy to obtain, many poor women choose to have fewer children. And with fewer children to support, they are able to earn higher salaries and accumulate greater wealth. And so the bottom line here was really tackling poverty, you know, within some of these communities, but using that intervention that study then did and provided the impact of that intervention. And so apart from just showing the finding, you know, that this is what happened when this intervention was provided, I think the importance of that is for policymakers to see that when you implement something like that, you actually get families, you know, increase their income as well as accumulate wealth over time. I think there's a second, I thought there was a second implication, but there isn't. But I think just to note that with different researches or information, we'll often have different implications. And so useful for us to think all different angles that you're providing a series of implications, but also they're really helping us to demonstrate to the audience you're trying to reach that this issue is important and that it can help us tackle perhaps broader development issues. So then the recommendation that came out as part of that is, as part of a national poverty reduction strategy and to increase household income in that country, policymakers should invest in family planning programs so that every woman or couple who wants contraception has access to it. And so what they've tried to do in this recommendation is really to, they've tried to make it specific. They've also tried to have a timeline on the need for Bangladesh to increase this by 2030. They've also tried to be specific on who should be acting on this. And so they're basically targeting policymakers, that policymakers need to invest more in these family planning programs. And so these are recommendations that I think they try to ensure it's specific. They try to ensure they're clear on who's doing what, but they also try to provide some timelines on when this needs to be done. I think we have one more example and then we will get back to questions. In this finding, there are actually a couple of findings here that I can just, I think, read through slowly, but as we all look at it, that 1 in 3 women globally experience intimate partner violence. Women who experience intimate partner violence have higher rates of unintended pregnancies. Women who experience intimate partner violence are up to 1.5 times more likely to become HIV positive. And that women who experience intimate partner violence have higher rates of induced often unsafe abortion. So what do these findings mean? Some of the implications that have been put up here, the findings suggest that women who experience intimate partner violence may need special attention because they seem to be experiencing unique issues on the other slide. And that addressing the needs of women who experience intimate partner violence is central to broader goals of addressing unmet need for family planning and promoting equity. So again, just trying to add value, to add substance and importance to the findings that they have for the policymakers to see the importance of them addressing these challenges. And then the recommendation given here is the need to develop comprehensive guidelines for tailored family planning care for women who have experienced intimate partner violence. And then the need to dedicate funding to enable programs to serve women who experience intimate partner violence. And that funding should specifically address training of providers, people who are providing services, provide adequate staffing. I think they did find staffing was not enough to address the needs of these women. And then of course, provide referral networks, which is important because sometimes health facilities at the community level are not necessarily the best to address some of these challenges. So the need for these women to be referred to higher level. So again, these recommendations, I think you can see, I can say they're more specific. They're not necessarily time bound. So we don't see them being time bound, but at least we see them being specific on what needs to be done. So we'll, I think, get into practicing in a few minutes, but I thought it's just better to cover the remaining parts of the elements of the communications, the strategic communications component, because we won't get into practicing some of this. And so we have covered up to 4, and we just talk very briefly about formats, pre-testing, implement, and evaluate in just a few slides. So about formats is really choosing the most appropriate format for your audience. So going back to the audience we talked about earlier in ensuring that we are using formats that will actually reach those audiences. And so you can consider print materials, which would be, wall charts, fact sheets, booklets, policy memoranda. You can think about presentations using graphics, audio visuals. And then you can also think about live and virtual events, conferences, seminars, briefings. The media, I think, is always an important channel. And I think we did talk about it earlier in terms of linking journalists to the technical working groups. The media is so critical, particularly in shaping public discourse and public understanding of some of these issues that sometimes the public is not very aware, or they are aware, but they don't know that we have very good solutions to these issues. So through TV, radio, sports, news releases, really innovative ways of engaging the media. And then of course, electronic channels, which is websites, blogs, tweets, Facebook, and all this listed here. The main point here is that we shouldn't think of just using one format, but we should think about mixing formats, and so using the media, using your print materials, using electronic channels should be a mix of channels that work, or formats that work for you, as opposed to getting stuck on one format. Very important to pre-test your messages, because this can dramatically improve the effectiveness of materials, and it doesn't have to be expensive. Often as researchers, for myself, we actually pre-test our messages mostly on our staff or partners who we work very closely with, or we are implementing work together. And so we don't have to spend money on it. We just need a bit of time to even do a presentation like this to colleagues and say, when I present like this, does this pass the message that I want to present? So something really important for us to think about in terms of pre-testing our messages before we release them to the target groups that we are trying to influence. And then finally, of course, is implementation. If we don't implement our messages, then nothing gets done. But implementation means that you are clear on the products and you have to get them produced. You're clear on activities, whether there are dialogues you want to have, whether there are trainings you want to have with journalists, you have them clearly outlined in a work plan, and that you put in resources for this to be implemented, and you are clear on who's responsible and the timeline, and that you are tracking, the implementation of your communications activities. It's important to remember that you can always change your work plan. Things are never set in stone. And as you work in a political space, things keep changing. And sometimes opportunities open up for you to do something different from what you had planned to do. So just being clear that it's okay for you to be flexible, to take advantage of opportunities that open up for you to influence decision-making using your messages. Finally, of course, is evaluating and measuring success, looking at your outputs, but more importantly, the outcomes, did you achieve the outcomes you set for yourself? So this takes us back to our policy goal, our communication objective. Did we achieve those things we outlined that we wanted to achieve through our strategic communication activities? And of course, did you achieve the impact that you hoped to achieve? So I'll stop there, and I think just get us back to plenary, and exercise 3. And I think I want to I mean, the task is for the groups to design or write some 3 key messages for a specific primary audience that was identified in the first session. And so the primary audience is really, the people who can address your policy problem or your policy issue. The idea, the assumption I think I had made is that the group would have information or evidence based on which they would design their messages. I don't think that is the issue. I know we have researchers on board and we have policymakers on board, but I don't know whether we have any clear evidence that the groups can discuss and write up some key messages on the evidence, on the implications of that evidence, and provide a recommendation. If the groups don't have specific evidence they're working on, my idea was that could they find a report, an important report or an evidence report on the issue, and use that for this exercise specifically.